Hey, what's up everyone? Isaiah here, and today we are going to be talking about diagnoses. And this is a bit of a tricky conversation because I get a lot of clients who come into my office who have seen counselors before, or psychologists or psychiatrists. They've been treated for mental health problems, but they come in not knowing what their diagnosis is. So they have a rough idea, but they don't know specifically what's in their medical record. So I'm here today to talk about 3 things that you need to know about diagnoses when it comes to mental health and how you can advocate for yourself. Like and subscribe, that helps our channel to grow. Let's get into it. Okay, so the first thing that anybody needs to know about diagnoses is that if you are being treated by a mental health professional and your insurance is paying for it, you have a right to know what your diagnosis is. First, if your insurance is paying for it, then you do have some kind of diagnosis, even if your counselor or mental health professional never brings up that issue to you. Insurance will not cover the cost of your services if there is not some kind of diagnosis on file. So, first part of advocating for yourself is knowing that that's true, and then being willing to have a conversation with your mental health professional about what they see as the diagnosis and how they came to that conclusion. Like I said before, a lot of clients come to me and I'll ask them what their diagnosis was when they were working with other professionals. That helps me to get a history and a baseline for what I'm looking for, what particular symptoms someone else may have seen previously, and they can't tell me, or they have a very rough estimate but not specifically what the diagnosis was. And this isn't necessarily a problem. Philosophically, counselors will differ in how important they view as a diagnosis. Some of them won't have that conversation with their clients at all because they don't think it's relevant and it's just something that the insurance companies need to know. Some people are very precise and very exacting about that kind of thing and will have multiple conversations with their clients about that. So all that to say, any mental health professional that doesn't make that a particular priority to have that conversation with their clients, that's not necessarily a bad thing. They're not necessarily doing something wrong, but when it just comes to clients having that efficacy for themselves, being able to advocate for themselves, knowing what their diagnosis is a pretty important part of that, and being able to have an honest conversation with your professional about what they think is going on and how they're phrasing that in their medical record keeping. So the second thing that you need to know about your mental health diagnosis is that it is not set in stone. So I think some people get this impression that like once you've been diagnosed with something, you are stuck with it forever. And there is a sense that that medical record will stay with you for a very long time. But according to the DSM, there are time periods, there are discrete time periods where symptoms have to be present in order for a diagnosis to be made. So just because you've had a major depressive episode at one point, if you're not exhibiting those symptoms currently, that does not mean you still necessarily have depression. And it can be different based on clinician interpretation too. Again, a lot of these diagnoses are based on interviewing, so you're asking questions of your client. And sometimes you don't get very precise answers because this is just not the way that we think about things. We just don't typically think about symptoms in terms of, oh, I felt this way for 2 weeks now, and I've had this symptom for 3 weeks. We just don't report it that way. We have a general sense of the time period, but when you're living it, we don't keep that kind of record for the most part. And so when you start working with a counselor, it's very common for them to ask you to start keeping a log or some kind of journal about your symptoms so that they can get a better idea, a better sense of exactly what we're dealing with based on timelines, when things begin, how long they last for. The reason I stress this point is because I've seen clients make their diagnosis almost a part of their identity, that they don't know what they are without being depressed, without them being an anxious person. And I feel like because there's maybe a lack of education around the way that diagnoses can change and transform over time, that people are setting themselves back or discouraging themselves from making positive change because they've been labeled with this diagnosis. And I think that's an unintentional effect on the part of mental health clinicians and clients, but it is a really real phenomenon that we need to address and say that, hey, you are not always tied to whatever particular diagnosis you were given at one point in time. The final thing that we need to know about diagnoses is that they are not all the same. If you line up 5 people who have been diagnosed with major depressive disorder or some form of anxiety disorder, those will all look different. And the DSM, which is what we use for diagnosing here in the United States, is very particular about that. There are different specifiers that we can use to try to capture exactly what's going on to make it as individual as possible. without putting people into these broad buckets and broad categories. So there are different specifiers at the very basic level just for different levels of severity, from mild, moderate to severe, and with anxious features or with other kinds of presentations. These are ways of trying to capture the individuality of every person's mental health struggle and the way that their particular condition may be affecting them. There's even a category for unspecified, where somebody might exhibit some of the features within that category of disorder, but not fit the full criteria, or there might be some other reason for not specifying exactly what that condition is that the clinician is seeing. I think the most important takeaway from all of this is that diagnosing is a necessary part of the process right now with the way that insurance works, but that it is not the final word on whatever you are dealing with. It is a way for clinicians to more easily categorize and have a way of thinking about and conceptualizing what you are going through based on what you are reporting to them. It's also subjective and can change over time, and so it is not set in stone, and I think that needs to be said multiple times, because people can start to form their identity around a certain condition that may not be with them all the time. And again, different clinicians will handle diagnosis differently. That's important to remember, because that doesn't mean that someone's particularly doing something wrong or engaging in malpractice if they don't engage with diagnosis in a certain way. This video is just about making sure that you have information about how diagnosing works and what the process is like, and how you can continue to advocate for yourself in the mental health space so that you have the information that you need to make informed decisions about your treatment and how that progresses. Hey everyone, thank you so much for checking out this video. If you found this helpful as you're trying to navigate the mental health space, or if you're a counselor or a mental health professional trying to broaden your practice or develop your skills, go ahead and subscribe to the channel. That helps us to create more content for you and to continue informing people of how to navigate the mental health space. Again, thank you so much for checking out this video. Be well, take care of yourself, take care of the people around you.